Mr. Secretary, we thank you for joining us. You've been at this 100 days now. You've released this report. What did you learn?
Well, really, this report is a summary of what people have been saying for many, many years. We have a chronic disease epidemic in this country that is now existential for our country. We're spending $4.5 trillion annually on health care in our country. And we have the worst health outcomes. That's 2 to 3 times more than anybody spends in Europe. And we have the worst health outcomes. We live shorter lives. We're more drugged. We're over-medicated. We're more obese. We have higher autism levels. We have higher diabetes levels and higher chronic disease than anybody in the world. When my uncle was president, the chronic disease rates in this country, I was a 10-year-old boy, were 3%. Today, among children, today they're 60%. 75% of American kids cannot qualify for military service. Our health care costs are expanding at 2% greater than our economy. So this is existential. Fertility rates today, American teenage boys have half the sperm count, half the testosterone as 65-year-old men. Our girls are reaching puberty 6 years early. They are on antidepressants, they're on ADHD meds, they're on antipsychotic medications at levels not seen anywhere else in the world or historically anywhere. And it's coming from environmental exposures, from our food, from lack of exercise, and from chemical exposures across society.
I do want to follow up with you about on that stat about the testosterone, but let's move on here. So we know that the Trump administration, right, which you're a part of, is cutting your budget by 25%. You're letting go of staff, defunding some research. How much more studying do you want to do? In the spirit of government efficiency, why not give us a 70-page report of solutions? Because you know you could have written this on day one.
Well, this is the first time in history that there's been, my uncle tried to do this in 1962 when Rachel Carson's book came out, and unfortunately was killed before he was able to do this. And we've been waiting for 60 years for the government to recognize the negative impact of these environmental exposures on the American people. So this is the first time in history that all of government has come out with a consensus document that all the cabinet officials agree on. Right. And that says we are in an existential crisis now in our country. It's important. The government has never admitted that before. And today we're all admitting it, and we're saying now we're going to do something about it. We have 60 days. This was the diagnostic. Yeah. In 60 days, we are going to deliver the prescription of the initiatives that we need to do. But we're already doing it.
And that's a pretty quick deadline.
We're already getting rid of chemicals in our food, of food dyes. Right. Which people have been trying to do for years. We did it in the first 100 days.
But I mean, one of your 10 steps moving forward from the report, and I went through this, we're going to put this up for our viewers. You want to conduct long-term trials comparing whole food diets versus an ultra-processed food diet. Secretary, don't we already know that whole foods are better? Why are we wasting time here?
We're not wasting time. We are already in the middle of completing the dietary guidelines. We're reducing the dietary guidelines from a 453-page document that we inherited from the Biden administration that was driven by the same industry impulses that put Fruit Loops at the top of the food pyramid. We're going to deliver instead a 4 or 5-page document that tells people how to give healthy food to their children. Those dietary guidelines will then drive changes in the school lunch programs all over this country. We are writing SNAP waivers every day to the states that are applying for them so that sodas and candies are no longer available using food stamps. Taxpayers should not be paying for food-like substances that are chemically based that are poisoning our population.
And unhealthy lifestyle. I get that. You've been a crusader for medical freedom, and you've questioned the use and the safety of vaccines in the past. And yet, in this report, some of the language over vaccines seems to be measured, right? You essentially are just asking to study it more. I'm wondering if your stance on vaccines has evolved.
No, that's always been my position. What's evolved is how the press covers it. The press, particularly this network, has mischaracterized my position for 20 years. I've always said what we need to do, the vaccines that are currently on the schedule, which has now required 77 shots between in utero till 18 years of age. Only one of those, the COVID vaccine, has ever been tested in pre-licensing studies against an inert placebo. That's not science. We need clinical trials that are based upon real science that allows parents and physicians to know the risk profiles of these products and then make good choices.
Mr. Secretary, Mr. Secretary, experts say that what you're just saying is not true, that they have been tested. Even Senator Cassidy, who's a Republican, has come out and corrected you on the record when it comes to those examinations. Do you understand that? And do you believe that?
And the day after Senator Cassidy said that, I sent him the clinical trial data that shows that he was wrong, and I can show that to anybody. In their own manufacturer's inserts, the vaccine companies admit there were no clinical trials that used an inert placebo for any vaccine except for the COVID vaccine. Oh, that's not science. It's morally wrong. We need to know what the risk profile is of these products and the benefits, and allow parents and physicians to make good choices for public health.
You say children are over-medicated. What's the solution then for parents, in your opinion?
Well, there are many diseases that can be treated with food. In fact, in many cases, juvenile diabetes and prediabetes, which now affects 38% of teens, can be reversed completely by changing diet. So lifestyle changes, dietary changes, food is medicine, and food also affects mood, it affects mental illness, it affects the immune system, and we need to make sure our kids have access to good food and that parents have access to the best information so they can make good choices for their children.
But you also agree that there are just some diseases, vaccines do work in some cases, chemicals that are put together in medicine to help children, to help adults, those work too. It can't just be with food, though. You agree to that, correct?
Of course.
Okay.
And vaccines prevent many, many diseases, and they prevent the spread of those diseases.
How do you see your role?
But what we need to focus on is, why are our kids so sick?
Yeah.
We're doing a good job at developing treatments for colorectal cancer. But we never had colorectal cancer in a child until this generation. Why is it exploding today? Shouldn't we be asking those questions as well?
When you testified before Congress, you made a very interesting statement. You said people shouldn't look to you for medical advice because you're not a doctor. But you are leading Health and Human Services. So what do you see your role as?
My role is not to give medical advice to individuals. My role is to run an agency that is committed to gold standard science, which has not happened, which has been corrupted at the public health agencies in the past. The science is not replicated. The data are not routinely published, the raw data. The peer review are not published, and it incentivizes scientists who receive huge amounts of funding from NIH to cheat. And we're going to end that incentive so that we get real gold standard science that can drive good policy for our political leaders and for the American people.
Secretary, while I have you, I do want to ask you about measles and vaccinations against measles. It's been the deadliest outbreak in this country in decades. Where do you stand on the measles vaccine? I just want to make sure I understand where you stand.
Listen, my agency has recommended that people take the vaccine to prevent the disease. There are many people in this country who won't take the vaccine for religious reasons. The MMR vaccine contains millions of particles that are derived from fetal tissue, millions of fragments of human DNA from aborted fetuses. And for religious reasons, they don't want to take it. We need to take care of that population, too. We need to have treatments for measles. No child should die of measles in this day and age. But we need to know how to treat measles. Physicians know how to treat it on the front line, and CDC has not been providing them those protocols. I will say this. We've done a better job at containing our measles outbreak than any country in the world. We have right now 1,035 measles cases. We only had 27 new ones last week. So it's plateaued and it's going down. In Mexico, they have 1,400. It has a third of our population. and it grew by 150 last week. In Canada, they have 1,800. That's 1/8 of our population. And it grew by 340
and we've
last
seen recently,
week.
and we've seen recently that communities, when they find it in their backyard in America now during this outbreak, they have started to get the vaccine. Do you feel your earlier comments on the measles vaccine were irresponsible? Have you learned since you become secretary?
What comment?
Just any comments in measles where people maybe thought you were a bit ambiguous whether they should take it or they shouldn't take it?
I think people should have good information. People should be able to make their own choices. They should be able to know the costs and the benefits of all these interventions. And they ought to make their own choices. And we should support them as a society. When people have religious objections to taking a product that does have risks, that we ought to give them support and medical care nevertheless.
Two more questions for you.
Our nation is a compassionate nation. We shouldn't make choices based upon people's belief systems.
Finally, Secretary, I'm going to ask you a question that's a little different, but it perplexed some people, and I'd like to get your answer on it. You posted these images of you and your grandkids swimming in Rock Creek Park. There are warnings of high levels of bacteria, that the waters are contaminated, yet you jumped in, and this sort of was your founding issue, was dirty water. When you look at the websites for the national parks, it says there's high levels of bacteria, that contact with the water is a hazard to human health. I'm a little confused. Why did you jump in and then dunk your entire body in there?
We weren't swimming in Rock Creek itself. We were swimming in one of the Rock Creek tributaries that, I don't think has those kind of, there certainly weren't any warnings. I think people should be concerned about the polluters who are putting pollution in those creeks. Those creeks belong to the American public. We have a right to use them for swimming, for fishing, and we should be concerned about people who are polluting them rather than people who want to exercise their rights.
Secretary, if you had a magic wand right now, what's one thing you would change about the way people eat in America?
I think ultra-processed food, I think that is the root cause, and sugars. I think if we could get rid of those, we could virtually get rid of diabetes in this country.
Secretary Kennedy, we appreciate your time. We thank you for joining Top Story tonight.
Thank you for having me.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.